Hello, everyone. I'm Dr. Marty Ross. Welcome to another Conversations with Marty Ross MD tonight. It's a webinar. We're going to talk about Lyme disease, and no 2 weeks are ever the same because you create them with your questions. As usual, I am very interested in seeing what you have in store for me tonight. For those of you that are coming here first time, there's a couple ways that you can participate. Number one, you can be bold on your first time here and actually write a question to me. And the way that you do that is down on the bottom of your computer is a chat box, and you can write your question to me through there. The other thing you can do is actually see what questions others write and the responses I give to those as well too. As usual, I am creating a recording of tonight's webinar, and I will send that out to you in the morning, somewhere between 9:30 a.m. in the morning. It'll be edited a little bit, but it'll have a summary attached to it as well too. We are having, I was originally not going to have the webinar tonight, and I had notified everyone in the last webinar I would be off this week, but I decided, looking at the July calendar, that there's a couple times I need to be off, so I decided to host it tonight. But because of that later notice, and I think because of the debates coming up tonight, we actually have a lower turnout. So we'll see if that kind of increases as the visit gets going here tonight. Let's see here. What else? Oh, as you're writing your questions, the one thing I ask is that you don't hit the enter key until the whole question is done. All right. And then also be aware that shorter questions work best for this format as well too. The reason I ask that you don't hit the enter key until your question is done is each time you hit an enter key, it sends your question to me. Whatever you've written, it sends it as a separate question, and it gets really hard to piece together all the parts to your question on my side if you've hit the enter key multiple times. All right. All right, so with no further ado, let's go and get started here tonight. Okay, so for those of you that are participating in live version, you probably are going to see that the first question is posting on your screen, so you can read along with me, but I will read these questions out loud so that those that are participating in the recorded version can actually see what we're talking about, okay? So this first question is from Robert. Hi, Doc Marty. If you take a spore-based probiotic like Megaspore, is it also good to additionally take the more common lacto and bifido varieties, or would taking the spore-based alone be sufficiently effective? Thanks. It's a really good question. So it's actually pretty impressive when you take, so the reason I talk about spore-forming probiotics is that they don't require refrigeration. All right, that makes them a lot easier than a lot of the bifido and lactobacillus species that are out there. Okay, so the spore-forming bacteria, everyone, are found commonly in the soil, and we historically, before our food was super cleaned up and sanitized, we would get spore formers into our intestines via the food we would eat. Okay. But the spore formers don't implant in our intestines. That's not how they work. They actually work by making short-chain fatty acids from fiber food that we eat, and peptides and a bunch of other signaling chemicals that actually tell the other bacteria in the intestines to grow better. So basically, they support the healthy microbiome, okay? Now, because they do such a good job supporting the healthy microbiome, even if you have just very, like almost minuscule levels of Bifidobacterium or very small levels of lactobacillus, they can refurbish and rehabilitate those bacteria that are there so that they take off on their own. So you actually don't need to be on what I call human strains like Bifidobacterium or lactobacillus while you're on spore-forming probiotics, because they're just not needed. The other thing, again, about taking the human strains is often you're going to have to refrigerate them versus the spore-forming strains, you don't have to. Okay. All right. I hope that answers your question. Good. Thanks for asking that, and good luck to you, Robert. Hello, Pedro. Let's see. Hi, Dr. Ross. Thank you for answering my previous question on June 6th. Taking your suggestion that my current Lyme-like symptoms may be due to yeast overgrowth, given that my IGenex confirmed Lyme infection treatment 10 years ago with IV antibiotics didn't address yeast at all, I asked my current LMD about treating me for yeast overgrowth. However, he recommended I get tests for mold first via real-time lab mycotoxin panel, urine, and VCS tests. I was positive for all 5 mold groups of ochratoxin A, aflatoxin, trichosethine, gliotoxin, zearalenone, and VCS was also positive. He started me on 3 binders and 1 probiotic, charcoal, Takesumi, Supreme, BioPure, Purinodosa, Organic, Corella 3 tabs, Mediclay, Premier Research, and Saccharomyces boulardii. After 4 weeks on binders, he then wants to introduce an antifungal called itraconazole. Question, do you think this treatment makes sense, or should I insist on yeast overgrowth? So Pedro, so the I'm limited in all the recommendations I can give here in this webinar because I just answer brief questions. Obviously, your practitioner had reason to wonder about mold toxicity as well too. So I'm glad that he looked for that. I still say though, the number one reason I see people get into decline is actually yeast. I do understand you have mold toxins in you. That still doesn't mean they're causing the problem. So I think you should treat them because they may be part of your problem. But because, again, 80 to 90% of the time that I see somebody that comes back in after having been treated and they get worse, there's usually yeast under it. I still strongly suggest that you get the yeast treated. I think what your practitioner is doing is he's going to be adding itraconazole, which is in the same family as fluconazole. So it is because he's going to be using it possibly to treat your yeast, although he may not agree you have yeast, okay? But he's also going to be doing it because he thinks that there's the possibility when you have mold toxins in you that you might have colonization of your nose passages or even your intestines with mold, actually, or fungus mold. And your nose passages and your intestines then could become a source for producing the toxins, basically, right? You become your own brew pub. Now, in the way I approach mold toxicity, I usually do not treat for mold colonization immediately because I find that about 80 to 90% of people don't have mold colonization as part of the problem. The main reason they have mold toxins in them is from breathing them in from moldy environments, either in previous homes that they had or current homes. And I find that I don't have to go in this next step and start killing mold that might have colonized you. So in my opinion, not 80 to 90% of people don't have a mold colonization problem, but I know there's a trend out there among a lot of Lyme literate medical doctors to immediately also, when they put you on binders, to pretty rapidly start treating with antifungals to treat mold colonization, where spores of mold live in your nose and start producing toxins. And so some of those practitioners do it right away up front. I don't necessarily agree with that, but that's what some of them are doing. And I suspect that's what he's adding in the itraconazole for. Be aware the itraconazole, that even if he's using it to treat mold fungus, it will also take care of your yeast, okay? Now, the other thing I would suggest, though, is that itraconazole is great for treating fungus, but the yeast and fungus can learn resistance to it. And so I don't like using it alone. I usually like combining it with either oral nystatin. It's a 500,000 international unit prescription pill, 2 pills twice a day. Or you could get an herbal compound on your own that you could take along with the itraconazole to prevent that resistance, and it actually helps treat the yeast as well too, maybe the fungus. But it's I like using antifungal pills, herbal medicines, and the one I prefer is a product called Capri Plus. That's CAPRI PLUS by a company called Karuna, KARUNA. It's got caprylic acid. It's got some oregano in it and also has garlic in it. It can be quite effective at helping too, and that's 2 pills twice a day. Okay, so in the end, I think the itraconazole he's using probably will get at what I think could still be an underlying problem, which is yeast, but he's using it again for probably to go after mold colonization, even though. Regarding mold colonization, one more thing, we don't have a way to test for mold colonization. Generally, you start wondering about mold colonization if you're treating somebody for mold toxicity and you're 6 months, 9 months in, and you're not making any headway in their toxin levels, then you start considering maybe they're colonized. And then my practice is at 6 to 9 months to add in an itraconazole. Okay. But again, some practitioners do it pretty much right away. Okay. All right. Good luck to you, Pedro. Guess you had a second part. Let's see. Do I think this makes sense? And yeah, I do think the rest of it makes sense. I mean, you do test positive for the mold toxins, but again, even so, the reason you might have gotten worse is because of yeast. Actually, in other words, you could have been cohabitating with these mold toxins for a while and not been bothered by them. By the way, I get a weekly allergy injection for dust mites and mold allergies. So not sure if my allergy injection is the reason why the mold test. No, that would not be why you tested positive. Okay. All right. Hello, Z. Hi, Dr. Ross. I'm pretty sure I have active shingles, not tested, but have symptoms, as well as Lyme, Babesia, and Bartonella tested through IGenex. As I have read Buhner's herbal protocols for both viral and bacterial infections, he recommends reducing L-arginine for shingles and increasing L-lysine, and encourages increasing L-arginine for Lyme category infections. If you are battling both viral and bacterial infections and you want to introduce L-arginine or L-lysine, which one should you give preference priority to? Or should you avoid introducing either one altogether? Thanks so much. So I know, so Buhner is recommending L-arginine for the tick-borne infections because L-arginine can help lead to dilation of your blood vessels, especially your small blood vessels. And the idea is if you can dilate those small blood vessels up, you'll get better penetration deep into your tissues of the antibiotics, herbal antibiotics, for instance. Okay. So that's why he recommends it. To be honest with you, I don't think it's needed. Keep in mind, Buhner's protocols are pretty extensive. He's put into his protocols about anything he thinks might give benefit. And I think sometimes they're a bit over the top, to be honest with you. I don't think the arginine is needed. Because therefore, I would probably focus on the L-lysine as being something that can help with herpes viruses. And so, yeah, that's what I would wind up doing. Okay. All right. Hello, Karen. Let's see. Hi, Dr. Marty. Our 8-year-old daughter was unknown to us, bitten by a tick in Germany at the beginning of May. 5 weeks later, she developed a bullseye rash, a swollen lymph node at the bite site, and a 1-day fever. At that point, the pediatrician did lab work, Lyme antibody by Lyme blot that came back negative for all strains of Lyme, and put her on 21 days of doxycyline. The pediatrician wanted to immediately stop antibiotics after finding out about the negative test result, but I insisted in continuing the doxycycline for 3 weeks. She is now symptom-free after the 3 weeks of antibiotics. My questions: shall I put her on a detox protocol and gut support protocol to support her recovery? If so, which protocol and what are the right dosages for kids? Shall we get her tested again? If so, which test and when? Thank you so much. All right, let's see here. So you can have negative testing for Lyme and still have Lyme. And the fact that she developed the symptoms she did related to having had a tick bite is enough to call that Lyme, especially a bullseye rash, okay? Especially if you saw the tick attached, okay? So that's enough to say Lyme. And I disagree with your pediatrician going just by the testing. Tests can be wrong in an acute situation like this. So you treat based upon the symptoms. I will let you know that many of us so when a person has an asymptomatic tick bite where they don't get a bullseye rash, they don't have any joint symptoms at all, etc. Mouse studies tell us that 20 days of doxycycline is all that's needed. I am of the opinion, and the International Lyme and Associated Disease Society and their treatment guidelines recommend that if you have a symptomatic tick bite, like your daughter did here, that it's better to go 6 to 8 weeks with the doxycycline. Now, I don't know if you're going to be able to talk your pediatrician back into getting more doxycycline, but you might want to print out at my treatlyme.net site. I'll show you here in a minute. There is an article I have on acute tick bite where I review the recommendations of the Infectious Disease Society, American CDC, and I contrast them with the recommendations of ILADS and other research out there that suggests going for 6 to 8 weeks, okay? And you might want to print that out and bring it with you to your pediatrician and talk with them again. The reason I think they're too short is there's a chance they may not have adequately gotten rid of the germs, even though your daughter's doing better. And your goal here in using antibiotics is to prevent her from getting chronic Lyme disease. Okay, so I just want to raise that point with you. All right. In terms of, there is not a test you can do that tells us that treatment is done. It just doesn't exist. Okay. If you wanted to get some confirmation about that she truly did have Lyme, I suspect your pediatrician used a test. I don't understand what you mean by Lyme blot. I wonder if you mean immunoblot, but the best test to see if you have Lyme or tick-borne infections is a test called an immunoblot, which is offered by IGenex. Their test looks to see if you have antibodies against 8 strains of Lyme, including the 2 major European strains in that 8 strains, okay? So the European strains are Borrelia afzelii and Borrelia guarinii, and the IGenex test looks for those. The IGenex test is 95% sensitive at finding infection or antibody reaction to the infection. And it would help confirm for you, if you're going to have to argue for more antibiotics down the road, that there truly is infection. And so I would consider doing that. All right. Now, I'm glad she's doing better. All right. And if you can't get more antibiotics, maybe the 3 weeks was enough, but the better scenario is 6 weeks to 8 weeks in these kind of situations. Okay. But the other thing is that to help protect her gut, you want to do things to help restore that gut. Now, that's while on antibiotics, actually, but also when the antibiotics are done. And so what you want to do, let's see, she is 8 years old. Okay. All right. So you could use, when it comes to using probiotics, you're not going to give too many probiotics. All right. So I would suggest working with a spore-forming probiotic for your daughter to help rehabilitate the healthy bacteria in her intestines. And the spore-forming means it's something called a bacillus species. The 2 products I recommend in my store for that is a research nutritionals product called Probiotic, or you can do the mega spore-biotic. Also, either one of those would be fine. Okay. And I would do 1 pill a day. For adults, I might go 2 pills a day. Okay, just to let you know, but 1 pill a day. The other thing you might want to consider, so if you get the product from Research Nutritionals, their Probiotic, it has a prebiotic in it as well. All right. If you decide to go like a mega spore biotic, it does not have prebiotics in it, in which case I would want to use a prebiotic product called Mega Pre. Okay. And you would do, if you do Mega Pre, I would do 1 a day with your daughter as well. And I would be on your probiotics along with a prebiotic for about 6 months. I would suggest that. Okay. In terms of detox protocol, I don't think there's anything useful in doing that, to be quite honest with you. So again, I'm recommending you consider longer doxycycline. Again, read my article, you'll see why. And then doing some rehab with a prebiotic probiotic. Okay. All right. So let me just do quick screen share here, and I see it and get myself set up to do screen shares. Hold on here just a minute. All right, let me try to see if I can do that screen share here. Okay, there we go. All right, so take a look. This is my Lyme information site, and take a look at my acute tick bite tab here. You read through this and you're going to see why I make a distinction about having symptomatic versus asymptomatic tick bite and the need to treat longer. I start going into that section down here. Okay. You could bring this, print it off, and bring all of these citations, include this references when you print this off, so that you can bring it to your doctor and try to encourage them to go a little bit longer. All right. And then in terms of the supplements, let's see here. In terms of the probiotics, so the core biotic, which I mentioned earlier here, again has both. This is the spore-forming one, and it also has in it this organic vitafiber, which is your prebiotic. So it's an all-in-one. Okay. All right. The other option would be to go with, where are we here? This mega spore-biotic, which is also bacillus or spore-forming product. And I don't believe it. Yeah, this one does not have any prebiotics in it. And so if you wanted to include a prebiotic, then you would look at this Mega Pre, which is your prebiotic. It's made up of fibers that feed the healthy bacteria so they thrive better. And that is 1 pill a day in your daughter's age range. Okay. All right. All right. Good luck to you, Karen. Oh, that was my store. Anyone can order from my store. Okay. So if you're wanting those products, that's a source for you. You don't have to get it from me, but that's a source for you too. Okay. Good luck with your daughter. So Karen, also, if she goes on antibiotics longer, you should be on the probiotics. She should be on the probiotics even while you're on the antibiotics. There is some data suggesting that being on probiotics is beneficial even when on antibiotics. Okay. Hello, Maya. Hello, Dr. Marty. Is it possible to get Lyme disease from spiders, mosquitoes, or some other insects, or only from ticks? Thank you. So that's the $1 million question. So we do know for sure that they are transmitted through ticks. Okay. But I have, many of us wonder if there are other vectors. There are some European studies that suggest biting flies, and I believe mites in some of those European studies question if they might spread it. I will tell you, I have had a number of patients in my practice where they got acutely symptomatic with Lyme symptoms after mosquito bites. And so I wonder if mosquitoes can too. But I'm going to tell you the evidence saying other vectors other than ticks transmitted just doesn't exist. Okay. But I question if other vectors may spread this. All right. Thanks for that question. Hello, Brian. Let's see, Dr. Ross. I have cognitive symptoms from Lyme and have learned that IV antibiotics are recommended. My question is, how do IV antibiotics attack neurologic Lyme differently than oral antibiotics? So, Brian, I want to let you know, most people that have Lyme also have neurologic cognitive symptoms of Lyme. Okay, it's very common. And it was true at one time. Well, actually, here in the States, there have been historically two schools of thought. Okay, there was the East Coast school, predominantly made up of doctors treating Lyme on the East Coast, and they tended to believe that IV antibiotics did best for all kinds of Lyme, including those with neurologic symptoms. On the other hand, there was the West Coast school of thought, of which I was part of, and we tended to say the IV antibiotics may help, but also orals can. And orals can do quite well, and orals can get good brain penetration too. All right. And so I tended to be with the West Coast school. I rarely used IV antibiotics in my practice in anyone with neurologic symptoms, and the great majority of them got well. Okay. So I don't believe that when you have neurologic Lyme, because just about everyone does, that you need to be on IV antibiotics. I rarely used IV antibiotics in my practice, and most people got well. Okay. All right. In my experience, what I usually say is that oral antibiotics work about 85 to 90% of the time. Any combination you initially start has an 85 to 90% chance of helping, which means if that one doesn't, you switch to another one, it also has an 85 to 90% chance of helping. Okay. IV antibiotics, on the other hand, have about a 90 to 95% chance of helping. All right. So you get about 5% difference of getting benefit. All right. But there are risks involved in using IV antibiotics. So first of all, you're going to have, usually you're going to have what's called a central line or a peripheral line put in, a big line put in to your veins, either here or up here, in the veins up here. Okay. Those lines are left in place for months. All right. And a month or longer. And they, even though you're going to have clean, sterile techniques to handle that line, there is a risk that you're going to wind up getting an infection in that line that actually crawls into the blood, and you have a bloodborne infection as well too. All right. That's one risk. The other risk of having IV antibiotics is if you have one of these lines left in place, the tip of the line can sometimes form small blood clots on the tip, and those can break off and float into the lungs, causing something called pulmonary embolism, and you get dead lung around where that blood clot lands in the lungs, basically. Right. Now, if you look at studies of people that are on IV antibiotics with a central line, like I just said, for or peripheral or a central line like that, over the course of about 6 months, 20% of people will have to have those lines removed, either because they develop infection or they develop a blood clot. So using the IV antibiotics comes with quite a bit of risk, actually. Okay. So to sum that all up, I'm of the school of thought that it's rare anyone should use IV antibiotics. And I think the majority of even the old East Coast school docs, many of them are not practicing anymore. And as I look at what's happening out of the East Coast now, most docs out there are tending to go oral antibiotics as well too. Okay. All right. Thanks for your question, Brian. Hello, Marie. Let's see how Dr. Ross. I've had chronic Lyme since 2005, and after treatment with herbs mainly and antiparasitics, I have been feeling better this past 1.5 years until I was rebitten a few weeks ago. I am noticing a new onset of symptoms and suspect it is due to this new bite, but maybe it's a relapse. Would you treat the same way if it's a new bite versus a relapse? Would you treat with antibiotics versus herbs? If it were a new bite, even though I already had Lyme, I usually try to avoid antibiotics, but I read your article on acute Lyme. Thank you for sharing what you think. All right. So what I can tell you, I would handle this as an acute Lyme, mainly because you had a bite and then you got symptoms. That's how I'm interpreting this. Okay. All right. Which the greater likelihood is that is a new Lyme versus reactivation of the old one, just by timing. Okay. So in an acute setting, we only have data saying that doxycyline, again, if you have symptoms, I would treat for 6 to 8 weeks, is the most effective way at preventing this from this new infection setting up as a chronic infection. All right. The difficulty with herbal antibiotics is we have no science telling us if they even work in an acute setting. They do work chronically. I mean, I know that because I've gotten a lot of people well using them, but we just don't know in an acute setting if the herbals work. So generally, my practice had always been to go with the doxycyline if somebody's symptomatic for 6 to 8 weeks, actually. Okay. All right. The other advantage that you have with that too is the doxy in an acute setting can also treat something called anaplasma or Leaky, which are other tick-borne infections that can get through, and can also acutely help with Bartonella and Babesia as well too. Okay. All right. Good luck to you. Oh, Marie, the other thing I want to let you know, we don't have testing that's going to be able to tell whether it's acute or a reactivation of your old infection, just to answer that part of the question too. Okay. I know you didn't ask that, but usually people wonder about that part too. Hello, Maya. Let's see, Dr. Ross, do you have an opinion on Immunoblot tests from Quest? I know IGenex is the best, although no test is 100% accurate. I wonder if it makes sense to do Quest Immunoblot at all. You answered my previous question in the Lyme group, and I am on doxycyline finishing 3 weeks now and seeing slight improvement every day. I am trying to decide if I should finish 8 weeks of doxy treatment and then test, or should I do it now or not at all and just watch my body for symptoms. Thank you. All right. So the Quest Immunoblot is actually a Western blot. All right. So it's an older method. It's not. So there are two different methods. Okay. So IGenex Immunoblot is a method which happens to test for against 8 strains of Lyme. So it's a better test at testing against potential 8 strains. Okay. The Immunoblot, so-called Immunoblot from Quest, is a different method, and I'll tell you what the difference between these two are in just a minute. But they're only looking to see if you have an antibody reaction against the original East Coast strain of Lyme, and they're not looking to see if you have reaction against the other potential 7 strains that we now know can infect people in the States. So the Quest Immunoblot, which is really should be called a Western blot, is only able to find Lyme 60% of the time, versus the Immunoblot method through IGenex can find it 95% of the time. It's 95% sensitive, the ability to find it when it's there, versus the Western blot / Immunoblot method that Quest is doing is going to will only have a sensitivity, the ability to find it 60% of the time. Okay, so let me just talk about the method of a Western blot and the method of an Immunoblot. So in a Western blot, what they do is they grow this one strain of Lyme from the early 70s out on the East Coast in a lab, and they kill the germ. And they take the proteins from the germ and they put it at the bottom of a cellulose test strip, and then they run electricity through the cellulose test strip, which distributes the proteins at different places based on what they weigh into this test strip. Okay. So that's, for instance, you probably have seen something called band 23. Well, that's all the proteins that weigh 23 kilodaltons fall out at the same place. All right. And then they take your blood and they take antibodies from your blood and they put it on the test strip. And if you have antibodies against some of those proteins, they should stick at that protein position. Then they add a coloring agent that attaches to antibodies stuck on Lyme proteins, which makes it so that we now can see things, all right? Also, at the same time, we prepared a control strip that has proteins, all those same proteins, but is a sample that has antibodies against every one of the proteins. And so on the control strip, we should see color at every one of the protein positions. And we look at your strip and we compare it to the control strip. And we say, okay, the control strip's got color here. What's going on in your strip? And it's this kind of hazy visual test where I think I see something there. Maybe I don't see something there. All right. Now, the problem with the Western blot is these proteins that your immune system makes antibodies against. Sometimes your immune system will have made antibodies against previous virus infections, like herpes virus infections or cytomegalovirus infections. These are common Epstein-Barr virus infection, monovirus. These are common viruses that live in people, don't cause us problems. We cohabitate with them. But the antibodies we make against them sometimes cross-react and attach to the Lyme proteins. So the problem when we see positive on a Western blot is we get a lot of false positives because there's not these proteins happen to hold onto virus antibodies as well. Okay, now on the Immunoblot, we use 8 strains. Okay, but we also grow the proteins from these 8 strains in the lab in bacteria. So we're doing a genetic production of the bacteria. And we modify these proteins in the lab before we produce them, before we program the bacteria to do it. We've modified them to remove pieces of the protein that would attract antibodies against viruses. Okay, so these are cleaned up proteins, all right? And so when we do this test for the Immunoblot, we have cleaned up proteins grown in the lab against 8 strains. So our chances of getting false positives is next to 0. Okay, and you get a better chance of finding out Lyme because we're testing against 8 strains. So it is a better way to go. Okay, in terms of testing, I think at 3 weeks of being on antibiotics, you can test now. And you're not going to change your benefit of what it's going to look like by going another 5 weeks or up to 8 weeks of antibiotics. All right. Okay. Good luck to you, Maya. Hello, Vicky. Let's see. I had attached tick on my arm, I think less than 24 hours. There was no rash, and I sent the check into a place back east to be analyzed or several different bacteria, which all came back negative. My question is, when I went into my doctor for the tick, I was given 1 single dose, 200 milligram of doxycyline. I'm wondering why that protocol would have been given to me instead of a couple weeks of doxycyline. All right, so I'm so sorry they did that to you. Okay, so first of all, I just want to look at the odds that this tick could have transmitted something to you. So if we look at the mouse studies, or actually human studies, to be honest with you, it looks like there is almost 0% chance of a tick transmitting if it is attached for 24 hours or less. Okay, almost 0. All right, now that doesn't mean 0, it's almost 0. So there are rare instances where people will get transmission, but I want to let you know the chances are almost next to 0 based on transmission studies. All right. All right. But this 200 milligram idea, so the Infectious Disease Society of America had developed a position saying that for acute asymptomatic tick bites, that a person should get 200 milligrams of doxycyline. And they made the decision to include that as a recommendation in their guidelines based on one study that is a pretty poor study. All right. So what they did in this study is they took people that had asymptomatic tick bites and they gave them a 200 milligram dose of doxycyline, and they looked to see if they would develop a bullseye rash. Right. That's the only thing they followed. They didn't follow any of their other Lyme symptoms. They only followed the people for 3 weeks. They didn't look at them again in 8 weeks, a month, 3 months, 6 months down the road. And they didn't look at all the other symptoms you get with Lyme. They only had one endpoint they were looking at is, do they get a bullseye rash? And it is true that people that took their 1 pill or 200 milligrams doxycyline did not get the bullseye rash, but we do not know really whether it stops people from getting chronic Lyme disease down the road because they didn't study all the other symptoms and they didn't study these people long enough. Okay. So most of us all of us in ILADs, when we look at that study, and that is the one study they base their recommendations on, are just absolutely appalled at this idea that we're giving people a single dose of doxycyline for an acute tick bite. Okay. In your situation, I think you're fairly safe at not doing anything for a tick attached for 24 or less than 24 hours. But if you wanted to have absolute certainty, I would go on 3 weeks of doxycyline as 100 milligrams twice a day. Okay. All right. Good luck to you, Vicky. Vicky, you'll see read my acute tick bite article where I also do talk about this 200 milligram dose in there, why I really don't recommend it. Okay. Oh, you have a second part here. See, I also had a second diet about 10 days later that resulted in some swelling, redness again, went to the doctor. I was given one single dose, 200 ml doxy. What are your thoughts? Yeah, anyhow, I think I answered that question for you. Okay. Hello, Karen. See, hi, Dr. Marty. I have another question about our daughter. I never saw the tick. I assumed it is a mosquito bite until I saw the bullseye rash. When you said taking doxycyline for 6 to 8 weeks, does it matter that she finished the 3 weeks about a week ago? There would be a break of several days in treatment. If I can convince the pediatrician to prescribe 3 to 5 more weeks, what about the danger of tooth staining at kids at that age when being on doxy? The IGenex test is best done at the end of the 6th. Okay. So regarding the tooth staining thing, so the U.S. Centers for Disease Control recommends for Rocky Mountain spotted fever giving doxycycline. Okay. And because it is the best agent even in kids, and because of this fear of tooth staining, they commissioned a study that looked at, do kids get tooth staining for short-term use of doxycycline? And they did study, and the people that got on the doxy were given, I think in their study, 10 days, but they actually had they did comparison of tooth coloring, et cetera, and they showed for short-term use, there is no staining of teeth. And I think their study, again, was either 10 days or 2 weeks, but my opinion is for short term, even up to 3 weeks, doxycycline, there is not a tooth staining risk. And most of that tooth staining risk is in kids under 8 years of age. Your daughter is 8 years and older. So I think it would even be okay to do up to 2 months of doxy with her now. That's again, well, yeah, I think you'd be okay doing that. Okay. In terms of testing, you could even get that test, the IGenex test now, to be quite honest with you. Okay. And yeah, anyhow, so the idea of tooth staining on doxy is kind of overblown based on these studies. I reference that study in my acute tick bite article as well too, if you look at that. Okay. All right. Good luck to you. Hello, Bob. Let's see here. When dealing with leaky gut issues, do you recommend using butyrate supplementation or prebiotics that produce butyrate? So butyrate, everyone, is a fatty acid, a short chain fatty acid that is a major fuel source for the cells that line your intestines. Okay. And it is naturally made within the intestines by bacteria that ferment fiber, prebiotic fibers. There are some strong butyrate producers, but there's a group of bacteria that really produce a lot of butyrate, and that is one way to get the butyrate. Another is supplementation, but when I've looked at the studies, that supplemented butyrate is hard to get where it's needed. My impression and also my experience says that using probiotics is probably a stronger way to get that butyrate. And so I don't recommend, in fact, I'm considering actually writing an article just on leaky gut syndrome, separate from my big gut article that I released about 3 or 4 weeks ago. And in there, I will specifically address butyrate. But looking at some of the studies, this butyrate supplementation is not as effective or well absorbed. And I think it's better to just have your bacteria produce your butyrate for you. Okay. All right. And as you know, Bob, probably from looking at some of my information, one of the best products I think that is great at producing butyrate is I like using a product by Pendulum, which is called Metabolic Daily. It has 5 strains of bacteria in it. Actually, let me just do a screen share here for y'all. Okay, so So this is the product. It's Metabolic Daily, and it's got Akkermansia is one of the big strains. It has 3 butyrate producers in it, of which are anaerobe butyricum hali, Clostridium beijinki, and Clostridium butyricum. Okay, and then it also has some Bifidobacterium in it, mainly to help start some of that fermenting that is then used by these butyrate producers to make butyrate. All right, so this is what I recommend, especially for people with leaky gut. And I recommend this product because, let me get out of here. Well, actually, I recommend this product for a couple of reasons. Number one, it helps lead to natural production of butyrate. Secondly, I like it because that Akkermansia is great at producing mucin, which is a protective coat that covers your intestinal cells. All right. And so you get rebuilding of the mucin layer, and then you also get a powerhouse of producing butyrate. And so I would recommend, especially leaky gut, 2 pills 1 time a day on this. Okay. Oh, one other thing. So I just mentioned it. For those of you that are not aware, about 2 weeks ago now, I released my guide to your microbiome. And it's this article called Good Shit, Your Guide to a Healthy Intestinal Microbiome, Even on Antibiotics. In here, I talk about leaky gut and the strategies you should take with your probiotic, and making sure you're getting prebiotic fibers and polyphenols, which you can either get through your diet or you supplement those. But read this article, you'll see more information in there. Okay. All right. Thanks for your question, Bob. Good luck to you. Hello, Brian. Let's see, Dr. Ross. I've been taking doxycyline for chronic Lyme for about 4 months now. After small initial improvements, I haven't noticed significant change for probably 2 months. Are there any potential benefits to continue the doxy treatment? If I stop taking doxy without starting another antibiotic, can I expect to regress and lose any gains that have been made? I have multiple allergies to antibiotics, so it has been difficult to pulse different types of antibiotics. All right. So, you said the word chronic Lyme, so I wanted to make sure this wasn't for acute Lyme. So for chronic Lyme, if you're on doxycycline or any antibiotic, herbal or prescription, and you stop them, you may not see, and if the germs are still very active in you, you may not see any real decline in how you're doing for about 4 to 8 weeks. It takes about that long. Okay. The reason is the Lyme germs are extremely slow at replicating. They replicate about every 4 weeks to every 8 weeks. So you don't get enough of an increased germ load for a while after you stop your antibiotics before you start seeing increased symptoms. All right. So that's one thing. Okay. The other thing I'll let you know, if you saw initial benefit and that kind of stalled out, you may want to think about changing what you're doing for your antibiotics. So you might want to try different orals or prescriptions, or you could look at herbal antibiotic options as well too. All right. And so I don't know if you've tried any of the herbal antibiotics, but there are a number of good ways that you could use herbal antibiotics that would be alternatives for you to consider as well too. Let me just do a screen share here. I'll show you an article you can take a look at on that, the herbal side. Okay. Okay. So the other more recent article I released is this one called Best Herbal Antibiotic Plans for Lyme, Bartonella, and Babesia. If you click on that, you're going to see a number of different options that you have for using herbal antibiotics to treat each one of these infections or treating all of them at the same time. Okay. So you might want to take a look at that as well too. Good luck to you, Brian. Hello, Maris. Yeah, Doctor. My deepest sympathies to you for your loss of your dog. Hope your other dog is doing well and not lonely. Your dog's had a wonderful life with you. God bless you for all the help you extend life. Thank you, Mary. Yeah, everyone. So you may see that there's a painting of my two dogs. The one that's closest to the wall is Halo, and the other one is Thor. And Thor is still with me at 15 and a half years old. But Halo, I wound up having to assist her over to the other side. I had to have her put down about 2 to 3 months ago. I guess it all becomes a big blur. She developed a big tumor on her face, unfortunately, and was just suffering too much. So I had to let her go at about 16 and a half years. So they've been with me for a long time. They're half siblings, and Thor still he's laying on he's sleeping over there, but Thor is still with me. So thank you. I appreciate that. Hello, Bob. Was he still dealing with system-wide body aches that feel more like tendonitis and tend to move around my body, but the same set of areas? One day it will be low back, another the shoulders, another the hips, another the tendons in the back, knees, etc. Taking some magnesium and glutathione and some probiotics to try to tame this down, but nothing seems to help yet. Any ideas, thoughts? Aches are worse than the AM and get better as the day goes on. All right. So one thing I want to let you know is that wandering pain is a symptom of Borrelia. All right. It's very particular to Borrelia. So that's not uncommon for people to get. That pain is related to both local inflammation and your body-wide cytokines also as well too. So taking things that lower cytokines like glutathione, and then also I would suggest being on something that has curcumin in it would be beneficial. So curcumin is a component of turmeric, and it gets inside of white blood cells and limits their production of inflammation chemicals called cytokines. Those cytokines are in part what give you a lot of your pain. The glutathione works at lowering cytokines by blocking oxidation agents that tell the white blood cells to make cytokines. So used together, glutathione and curcumin can be quite effective at lowering inflammation in the body, okay? Now, the other thing you can, and then also you want to be treating your infections. So you don't mention that here, but you ought to be treating your underlying infections. Magnesium sometimes can help, but you want to be really good about getting the cytokine inflammation down with a combination of liposomal glutathione, 400 to 500 milligrams a day, and curcumin, 500 milligrams 3 times a day. Now, if you're doing that and you're still having a lot of wandering pain, there's a couple other steps you could take. Number one, you could try the peptide called BPC 157. So BPC 157 is a peptide that is made in our stomach linings. It's natural. And it is a primary purpose in us is to actually help our gut work better and to heal our gut when it's injured, all right? But it has also been discovered that it is quite good at repairing tissue injury within the body. And it is useful also at regulating inflammation too, okay? And so you could do 1 pill twice a day of a BPC 157, for instance. The other option, if you don't want to do a BPC 157, is see if you can get a prescriber to prescribe something called low-dose naltrexone. Naltrexone is a narcotic blocker. And when we use it as low dose, we're actually having it compounded anywhere from a 1.5 to a 4.5 milligram pill. In the pharmacies, it's made as a 50 milligram pill. Okay, so the reason we call it low dose is we use it a lot lower dose. And what it does is it blocks our endorphin receptors, and endorphins are a natural group of chemicals we make that regulate our pain, but also regulate the immune system. Okay. And if you provide blockade of your endorphin receptors for a short period of time, that can help calm the inflammatory system, all right? And so LDN, and I usually start people at 1.5 milligrams a day, working up to 4.5 milligrams a day over 6 weeks can be another way of getting this chronic inflammation under control. I think, though, of the LDN and the BPC 157 recommendation, in this kind of a situation where you got a lot of inflammation and probably tissue injury, the injury would also be repaired by the BPC 157 versus the LDN tends not to or does not do that tissue repair. Okay. All right. So I've just said a lot of stuff. I want to do a screen share and show you some resources here on that. Okay, so regarding the low-dose naltrexone, take a look in my immune system section here. And this is the article I have about low-dose naltrexone. Okay, all right, so take a look at that. All right, that's an option for you. The other, and I think I have it in here, but let's see if I do or not. Yeah, okay, so then the other article to look at is this one called Key Oral Peptide Strategy to Repair and Restore Lyme and Mold Toxicity, where I talk about various peptides, but you can look at the information I have here on BPC 157, okay? So it is also sold as a supplement. And then in terms of the BPC 157, you can find it. It's made by a company called Integrative Peptides. And this is the BPC 157 right here. Okay. All right. And then, so that's an option. And then in terms of curcumin, the curcumin I like is a product made by Thorne called curcumin phytosome. And it is a liposomal form of curcumin that gets absorbed very well. So that's what I recommend. And then in terms of the glutathione, I prefer this product called Trifortify. It comes in different sizes and single dose packs and tubes, etc. But the reason I like the Trifortify is it's liposomal also to increase the glutathione absorption, which is really key in getting glutathione in you. And Research Nutritional's got a good study showing that they really do have good absorption of their product. Okay. All right. All right. Good luck to you, Bob. Hello, Marie Eve. Hold on here just a minute. I get a sip of water. Let's see. Hi, Dr. Ross. As you discussed earlier, mosquitoes might transmit Lyme, even though there are no proofs of that. Could mosquitoes then also transmit all the co-infections according to you? Thank you. You know, I haven't seen, I don't have anecdotal evidence, meaning I've never seen it transmit the other infections in my practice, all right? Nor am I aware of science, especially science on Babesia. I don't think it's a vector for Babesia. Bartonella, there's a lot of different vectors of Bartonella, so I don't know whether it does Bartonella or not. I don't know that one off the top of my head. I'd have to look into it a little bit more, okay? All right. Oops, sorry about that. Hi, Mary. I see. Can Q fever masquerade as tick infection with similar symptoms to Lyme and Bartonella? I suppose it can. I mean, because it's going to be a type of infection that can kick up your cytokines as well, too. I've never seen it in my practice out of the West Coast. I know Dr. Richard Horowitz out on the East Coast thinks he has seen it in his practice before, but I haven't seen it out on the West Coast. Okay. Hello, Teresa. Let's see. When is it advisable to avoid glutathione when dealing with mold infection? Oh, I don't think it's advisable at all, actually. And in fact, some of the protocols to actually Let me step back for a minute. So there are some practitioners that in their protocol to do the urine testing for mold toxicity, actually encourage people to take glutathione to actually improve the possibility that those mold toxins will wind up in the urine. I don't see a reason. I would want to know a little bit more while you're asking this question, but I've never had any problems using glutathione with mold toxicity in my practice. Okay. All right. Thanks for our question, Teresa. Good luck. Hello, Marie again. Let's see. Hi again, Dr. Ross. After you discussed the different Lyme tests earlier, I realized on my IGenex Western blot from 2013 it is written a positive result for 8393 and 41 may present in persons infected with HSV, EBV, HCV, and syphilis and may give false positive results. This is for IgM. Would this mean this could be positive because of my EBV past infection and not Lyme? Yes, it could be, unfortunately. There's a small chance you have a false positive test there. But typically EBV, while it may give fatigue, it's not going to give a lot of the joint pains and neuropathies that people get with Borrelia. But yes, you raise a good point. It's true. All right. Thanks, Marie. Or Marie-Eve, I should say. Excuse me. Hello, Z. Let's see. Hi, Dr. Ross. I'm pretty sure I have active shingles. Oh, we already covered that one earlier. I see you posted it in 2 areas that you possibly can post it. So we've done that. All right. Hello, Carol. When is it safe to come off antibiotics and when should I start them again if I relapse? All right. So my goal for stopping antibiotics, there's 2 different standards that I have. All right. And one is that I will consider stopping antibiotics if somebody has been completely symptom-free, 100% healthy for at least 2 months. The other situation I'll consider stopping them in is if I've got recognizing that for some people, the Lyme infection may have left some permanent injury and that we may not get a person back to 100%. The other standard I have is to treat until I'm at a good plateau for at least 4 months. And I keep trying during that plateau to address other ways to move the treatment forward. But if I have exhausted all other options to move the treatment forward, and it's been 4 months that they've been plateaued, I will consider stopping antibiotics at that point too. Okay. Again, as you know, we just don't have a test that proves that we're done treating this infection. Okay. And then, with relapse, you can go back on antibiotics if you do relapse, but always consider, so if it's going to be because you're stopping antibiotics too soon, for Borrelia, typically if you've stopped your antibiotics too soon and you really did not have good enough germ control, usually by 2 months, you're going to start having a return in symptoms, okay? If you have Bartonella and Babesia and you stop antibiotics before it's too soon, usually the Bartonella and Babesia symptoms will return within about 2 to 3 weeks, actually. And the reason for the difference in how quickly they return is that the Bartonella and Babesia replicate more frequently than what the Borrelia Lyme infection does. Okay, all right. If it has been a year or 2 and you start getting symptomatic again, I always suggest to people consider the possibility that they have that they have intestinal yeast overgrowth. So in my practice, when people would come back, 6 months, a year down the road, 2 years down the road, resymptomatic again, 80 to 90% of the time it was due to having too many intestinal yeast, triggering excess cytokine production, which made it look like their Lyme was active, but really they were just swimming in cytokines again, producing most of their symptoms. Okay. All right. So things to consider and helping you decide if it might be too many yeast is there intestinal gasiness and bloating? Are there sugar cravings? Is there worsening skin problems like pimples and acne and eczema? The toxins that get released by yeast can trigger pimples and acne, and can even make your skin rashes worse, for instance. Okay. And then you also look at, did you have a recent sugar binge before you got worse? So did you feed all your yeast in your intestines? Does having sugar make you feel a lot worse? Those are some things to look at. And in women, are you starting to get vaginal yeast infections as well too? Okay. All right. Good luck to you, Carol. Hello, Carol. Let's see. Is there a difference between minocycline and doxy? Yeah. I mean, in terms of effectiveness, probably not. But let me just talk to you about the difference. So, minocycline and doxycycline are both in the family of tetracyclines. All right. Minocycline is a little bit more fat soluble than doxycycline, and things that are more fat soluble have an easier time getting into the brain. However, doxy has great brain penetration anyhow, but minnow may have a little bit better. Okay. Minocycline tends to cause less sunburning. There's less of a sunburning potential on minocycline than doxycycline. Because minocycline is more fat soluble, sometimes it gets absorbed into the coverings around the nerves in the brain and can become an irritant. So people might get dizzy on it. They might develop depression on it. So there's a little bit more side effect potential on the minocycline than the doxycycline. Okay. In terms of effectiveness at treating the infections, both have equal chances of helping. All right. Thanks for that question, Carol. All right, everyone. As I said, I think we had a lower turnout tonight. Yeah, we've got about almost one half of the normal amount of people we would have here in the live version here tonight. So I've answered all your questions. But again, I just don't think we had as many people show up. We actually had about 130 people sign up. Normally, I would have about 150 to 160. And normally, we'd be having about 60 people in the room in the live session. Not everyone that signs up shows up. But so we had a lower turnout tonight. I'll wait here for just about a minute to see if anyone else has a question. But we may close up. Brian's got a question here. Let's see. Hi, Brian. What type of treatment do you recommend for intestinal yeast overgrowth? So there's two ways you can go. So one is to start with, in terms of your germ killers, I like using fluconazole, which is a brother sister of itraconazole. All right. And I like to combine that with nystatin. And the fluconazole, I would dose at 200 milligrams one time a day for 30 days. And the nystatin, I would dose as a 500,000 international unit pill. I would do that 2 pills 2 times a day. All right. And that will work as a 90% chance of working over a 1 month period of time. Alternatively, you could try a 2-month trial of an herbal anti-yeast medication. The product I like for that is something called Capri Plus by Karuna. That's Karuna. Capri is with a C, and Capri Plus is all one word. That's 2 pills 2 times a day. It takes about 2 months to get your yeast under control, and it'll work about 80% of the time. All right. In addition, you need to be on a probiotic. All right. So if with your yeast you don't have any GI symptoms, you could use a spore-forming probiotic, either that core biotic I mentioned earlier or the mega spore-biotic, and you want to do at least 2 pills 1 time a day of those. Okay. But on the other hand, if you've actually got symptoms suggesting possible leaky gut with this, like intestinal bloating, cramping, gassiness and bloating, those kind of symptoms, you might want to look at that that Akkermansia-based product I mentioned earlier tonight, because it can help with leaky gut symptoms as well. And that would be to use that product by Pendulum called Metabolic Daily, and I would do it as 2 pills 1 time a day. Okay. All right. I can show you my protocol or an article I've written on this. The article isn't as up to date on the probiotics. I got to go in and fix that up. But let me show you the article I have on that. All right. So take a look in my yeast section. And here's my article on what you take to get rid of the yeast. Okay. All right. All right. Let's see here. Hello, Laura. Let's see what you got here. Hi, Dr. Ross. How does one know if parasites are a problem? What are the signs of a parasite infection? So, I'm not a big believer in the parasite theory. I just want to let you know that. I do think that there are people that do get intestinal parasites. I do not believe in systemic parasites. They're, in our quest to try to figure out why people don't get well, a lot of people have fallen into this theory that it's parasites living in the body. The only parasite that is actually involved in these infections that I'm aware of is Babesia, which is a blood parasite. But in terms of having, generic parasite infection throughout your body keeping you ill, Dr. Klinghardt out in Seattle has come up with that theory, and there's many people that have followed that. Most of the prescribers and physicians I work with, we don't see the science behind supporting that. I just don't see it at all. Regarding intestinal parasites, I do consider those from time to time, though. So parasites in your intestines, you could have gotten from a contaminated well. You could have gotten from travel to international places. And so I will consider whether a person might have intestinal parasites if they have a lot of GI symptoms that don't get better when I treat yeast. And if they travel to places that are less developed or they lived on well water. And the problem, though, with intestinal parasites is we don't have decent testing that will show all the parasites. In fact, testing, if you do stool testing, will miss about 40% of parasites. So sometimes I will just treat empirically. If somebody's got a lot of GI symptoms, they had traveled to those areas, they're not getting better, then I might treat for intestinal parasites, okay? Let me show you my article on that. Okay, so take... Okay, so this is my article about when and how to treat parasites. And again, the how to is more for intestinal parasites, okay? Thanks for your question, Laura. Good luck to you. Hello, Mary. Let's see. On the subject of probiotics, I feel fine before taking them. Within 15 minutes to 30 minutes after taking probiotics, I suddenly get severe abdominal pain and then projectile vomiting. It occurs with many different brands. I am afraid to take probiotics. Is it my histamine intolerance causing the problem, or is it possible there's an allergen in the probiotics? The one thing you might, this is one of those things I'd like to give you the best answer. I would want to be able to talk with you back and forth and try to problem solve this by asking you questions and hearing your response. Okay. But one thought I have is many probiotics have prebiotics in them. And some people cannot tolerate the prebiotics, especially if they have too much bacteria living in their small intestine, something called small intestinal bacterial overgrowth. If you put prebiotics into somebody, and those situations can be very irritating. So you might want to try a probiotic product that does not have prebiotics in it. The one that I carry at my store as an example is there is a product called Corebiotic Sensitive, which does not have any prebiotics in it. It's just regular, it is just the bacillus spore-forming bacteria that's in it. There are no other substances other than the gel capsule, basically. Okay. All right. Good luck to you, Mary. Hello, Brian. Let's see. Oh, we already answered that. Hello, Marie Eve again. Let's see. I use Corebiotic Sensitive that I bought from your store a while ago. Tonight, from what you're saying, I get that I should add prebiotics. So yes. So the Corebiotic Sensitive does not have prebiotics in it versus the Corebiotic Regular has prebiotics in it, okay? So in terms of producing a healthy gut microbiome, there are three things that are important. Number one, getting enough of a group of chemicals called polyphenols. Number two, getting prebiotic fibers. And number three, being on a probiotic, okay? All right, so in your food, polyphenols are found in colorful fruits, vegetables, and even in some of the beans and legumes and seeds, but usually the colorful fruits and vegetables. As an example, cranberries are rich and pomegranate are rich in polyphenols. Olives are rich in polyphenols, all right? But basically, if you have a plant-forward diet, emphasizing a lot of plants in your diet, and that you have a lot of color in there, you're probably getting enough polyphenols in your diet, all right? Likewise, if you have a plant forward, and I'm not saying plant exclusive, I'm saying plant forward, where you're getting at least 5 servings a day of plants, a variety of plants, and that means seeds and nuts and everything. Get at least 5 servings a day, you're probably getting enough prebiotic fiber in your diet, all right? If, however, you're not a person that has that much plants and is not plant forward with your eating, then I do think it's a good idea to supplement both the polyphenols and prebiotic fiber, okay? And earlier tonight, I think I showed you there's a product, maybe I didn't, but there's a product from Pendulum called Polyphenol Booster. That's your polyphenol source. And then there is the Mega Pre that I carry at my store, which is your prebiotic fibers, okay? Both of those would be 2 pills 1 time a day. So you would maximize and so the polyphenols and the probiotics are useful at supporting existing bacteria in your intestines to be healthier and grow, okay? And they also are prebiotics and polyphenols for whatever probiotic you're putting into yourself as well, too, okay? All right. Good luck to you, Marie. All right, that's it. Good being with you here tonight, everyone. I'm not sure how many of you are going to see the debate. That's my next thing on the evening here. I want to see what this show turns into. I wish you all well this week. Take a look at your email tomorrow morning, somewhere between 9 and 9:30 in the morning. You should have an email from me that will have a summary of what we talked about tonight, as well as link to the recording. All right. And I share it with others that you think might get benefit from it as well, too. All right. Good night, everyone.